Uh, a slide of striated branch muscle fibers with intercalated disc is observed, which junction types are present. Gap junction and desmosomes are present. Intercalated discs contain desmosomes plus gap junctions plus adherence junctions. A stroke patient has impaired cerebral perfusion. Which capillary type predominates in the brain? Continuous capillaries. The blood-brain barrier is formed by tight continuous capillaries. Identify the structure unique to cardiac muscle fiber. Intercalated disc. Reason they allow mechanical plus electric coupling through desmosome and gap junctions, which we have already discussed in the previous above mentioned BCQ. Which vessel has fenestration for rapid exchange of hormones? Capillaries. Endocrine gland capillaries. Fenestrated capillaries are present in thyroid, pancreas, endocrine glands. Which vessel has the maximum elastic lamina and tunica media? Large artery. Elastic arteries. Aorta stabilizes pressure fluctuations. Which feature helps veins prevent the backflow of the blood? It is the venous valves, because valves prevent the backflow of the blood. You can easily identify it. Prominent in the lower limbs prevent pooling. Otherwise, it leads to deep venous thrombosis. Which is most permeable, allowing cells proteins to pass? Sinusoidal capillaries. They have large gaps present in lung, liver, spleen, and bone marrow. Adult structure derived from the bulbous cordus is conus arteriosus. Smooth outflow region of the right ventricle. Primitive atrium develops into trabeculated portion of the both atria. Second pharyngeal arch artery forms stapedial artery. The aortic arch derivatives are very important, that can be asked to you in the SAQ, BCQ and Viva point of view, or it can be asked to you in the OSP. Aortic sac contributes to which structure? It contributes in the proximal aortic arch and pulmonary trunk. Failure of left common cardinal vein to regress leads to persistent left superior vena cava, normally left anterior, that regresses. Supracardinal veins contribute to azygous system and inferior vena cava segment. Failure of endocardial cushions result in atrioventral septal defect. Cushions form AV valves plus membranous VSD, ventricular septal defect. Which defect is associated with neural crest abnormality? Truncus arteriosus. Conotruncal septum development depends on the neural crest cells, which we have already discussed in the above mentioned BCQs. Right horn of sinus venosus becomes sinus venerum. Ductus arteriosus closes due to the high oxygen tension. Increased oxygen increases the smooth muscle constriction. SA node develops from sinus venosus. Inferior vena cava valve is a remnant of right venous valve. Tunica adventitia of large vein contains longitudinal smooth muscle. Coronary artery arises from aortic sinuses. Continuous capillaries are characterized by tight junctions and intact basal lamina. A vessel with a large irregular lumen and thin tunica media is likely large vein. Vasa vasorum are most abundant in elastic arteries and large veins. Which structure forms the trabeculated part of the right ventricle? Primitive ventricle. A 5-year-old child presents with a history of recurrent chest infections and difficulty breathing. Imaging reveals an abnormal air-filled pouch arising from the esophagus due to incomplete partitioning of the foregut. Which structure fails to develop? Tracheoesophageal septum. Incomplete formation of the tracheoesophageal septum results in abnormal communication. Tracheoesophageal fistula pouch. A trauma patient develops a large hemothorax on the right side after being stabbed. Which pleura is damaged? Visceral pleura. Blood accumulates between the visual and the parietal pleura. Direct lung visceral pleura. Hemothorax. But this BCQ is from the respiratory system. During a routine checkup of a newborn, a heart systolic murmur is detected. It is later diagnosed with that the opening between the ventricles has failed to close normally. Which structure was supposed to contribute closure? Membranous interventricular septum. VST commonly occurs in the membranous part formed by the fusion of endocardial cushion and muscular septum. A newborn presents with the cyanosis shortly after birth. Investigation reveals that the aorta arises from the right ventricle and pulmonary trunk from the left ventricle. Which developmental process was defected? Spiraling of the Aorticopulmonary septum. Failure of spiraling leads to the transposition of the great arteries. A patient was diagnosed with an atrial septal defect, which embryonic structure failed to fuse properly septum, primum, and endocardial cushions. Secundum type ASD results from improper fusion at the foramen primum region. A 2-month-old baby presents with the continuous machinery murmur. Blood flow from the aorta to the pulmonary trunk persists abnormally, which fetal structure remains patent ductus arteriosus. Failure of the constriction, patent ductus arteriosus. A 6-year-old boy presents with coughing, blood hemoptysis. Angiography shows failure of venous return from the lungs to reach the left atrium, which venous structure is defective. Pulmonary veins. Abnormal connection, total or partial anomalous pulmonary venous return. A patient with congenital heart disease has an overriding aorta and right ventricular hypertrophy as part of a 4-feature defect. Select this condition. Histology of Heart, 4 classic features which we have already discussed. Pulmonary stenosis, VSD, overriding of aorta and right ventricular hypertrophy. A neonate develops respiratory distress syndrome due to deficiency of surfactant, which cells are responsible for producing a type 2 pneumocytes, but this VCQ belongs to the respiratory part. They secrete surfactant, reduces the surface tension, prevent alveolar prolapse. A newborn requires immediate closure of the patent ductus arteriosus, which drug is administered. Indomethacin is responsible for it. It inhibits prostaglandin synthesis, promotes ductus arteriosus closure. That's it. Thank you.